that they tried to steal. Instead, the government coordinated to use our collective tools and authorities to protect taxpayer dollars. This takedown also demonstrates, though, our commitment to shield Americans from harm. The actions taken by our partnership stopped individuals and entities who are alleged to have used stolen medical identities from over 1 million patients to submit false claims. They preyed on patients who needed addiction services, billing for treatment that was never received. They illegally diverted prescription opioids, millions of pills that continue to fuel the devastating opioid epidemic. But as fraud schemes span borders and jurisdictions, OIG and our partners respond quickly and effectively. And as fraud schemes increasingly exploit technology, we use cutting-edge investigative methods to detect fraud, prevent losses, and protect patients. Before I close today, I must take a moment to applaud the exceptional work of the dedicated OIG professionals that participated in this takedown. Every day, these outstanding law enforcement professionals do the dangerous work of holding criminals accountable. Thank you for your service to the American people. Thank you so much, and I will turn the microphone over now to Dr. Mehmet Oz, the CMS Administrator.
Let me put on my clinician's hat first, because it is my culture, my story. I'm a heart surgeon. And when I hear about this fraud, I think about patients who have trusted us, people who are at their most vulnerable time looking for the protection of our services. And too often these criminal entities have tried to pierce that trust. When you walk into the Health and Human Services building not far from here, there's a quote from Hubert Humphrey, from whom the building is named, and it says, "It is the moral obligation of government," that's what we're doing here today, it's the moral obligation of government to protect those who are at the dawn of their life, our children, those at the twilight of their life, our seniors, and those living in the shadows, folks who are having trouble like the substance use disorder mentioned a second ago by Juliet. I want to applaud all of the agencies that collaborated today, because when President Trump signed the executive order on fraud, waste, and abuse, a pledge to crush this reality, this is exactly what he had in mind. At Health and Human Services, under leadership of Secretary Kennedy, we have strived to break down barriers and silos in every way possible. What you're witnessing on stage today is exactly that. The American government at its best, making sure all of us work together for the same common purpose, in this case especially, expressly to protect those who are our most vulnerable. Because all great societies are judged by how they take care of those who are vulnerable, and we are great people. We will do that. So to the OIG, the DOJ, who's hosting us, the FBI, DEA, and other agencies that were engaged. And let me ask Kim stand in the back. Kim Grant runs, Chief Operating Officer and Deputy Administrator at CMS. She runs the fraud unit, and I will speak about some of the work she and her team have been doing in my comments today. It is, and you'll hear this said by all of us, and we should, the largest Department of Justice health care fraud takedown in history. The fact that it's even possible that you could have $15 billion to play in this endeavor is shameful. But that's how we're being attacked now, and it's not done by small-time operators. As you're hearing about and you will read about, these are organized syndicates who are designing to hurt America. And why do they hurt our healthcare system? Well, CMS is probably the largest target of all, responsible for about $1.7 trillion of disbursements. So it's a big target on our side. And they can pierce the veil of protection by just getting identifier numbers from our seniors or Medicaid recipients or others, and thus use those tools, use you, the American people, to hurt us. What we're doing today is changing the paradigm. Not just going after bad guys and putting them behind bars, but actually getting ahead of these schemes so the money never leaves our bank account. Because by the time we find out that these criminals have stolen and the money has left the building, it's already offshore somewhere in some foreign country's vaults where foreign leaders are rejoicing in the fact they took advantage of the American people. That's why we use the word crushing fraud, waste, and abuse. Because this is not just a nice thing to do in an accounting pickup that we can, claw back money. It doesn't happen that easily. And this is a modern era. There are modern tools being used to attack us, and we need even more modern ways including AI, which I'll speak about in a second, to take them down. The oversight has to be unrelenting. We can never let our guard down. While we're sitting in here right now, there's hundreds of thousands, probably millions of efforts being made to hack into CMS and our system, and we have systems designed to prevent that, to make sure the people who need us the most will find that we're there to protect them. The CMS Fraud War Room that I want to announce that Kim is going to lead is an effort as an example of this. It's prevented most of the fraudulent efforts to take money out of our agency. So most of the money never left the door, so most of the money was never stolen, even though we know you were trying to do it. And when I speak to you, when the president signed that executive order, he put a bunch of sheriffs, new sheriffs in town. And that's what you're looking at on stage today, and many of us who are not going to tolerate this anymore. We're stopping stolen taxpayer money from leaving the door, stopping it in its tracks. Just when I was leaving the room today, the offices today, I was hearing about over $100 million that we have stopped from leaving the agency just in the past few weeks. There are 27 providers that are under active prepayment review, which means we're not going to pay their money until we verify that they're actually doing their jobs correctly. There's examples from telemed schemes in Florida with clinics billing for activities that they're not really, we don't believe, providing. There's a cardiology provider, and please help me understand this, who's providing cardiology services in person in Georgia and Nevada at the same time on the same day. Unless teleporting is being made feasible, not possible, but it happens. The audacity to think you could get away with this highlights the fact that folks believe they could have taken advantage of the agency in the past. We're going to make sure it doesn't happen again. Mental health clinics, listen carefully, mental health clinics providing skin substitute placement on their patients. Again, you're dealing with ulcers in a mental health clinic. These services are provided by an anesthesiologist. Improbable. Money's not leaving the building. You're going to have to prove to me that there's a clinical benefit of a psychiatrist telling an anesthesiologist to put a surgical graft on a patient. It's not going to happen. We need your help. That's my big plea. We need your help, the American people. Over half of the whistleblower tips that we get are for healthcare fraud, and over half of the fraud against our government is in healthcare. So we need your help, both to protect your own important information. Don't give it away because con artists come to your door and try to get it, but give us tips. You're going to hear all of us share opportunities that we have, but it only happens in healthcare because we know we have allies, the American people. We provide care to 68 million Medicare beneficiaries. 80 million Americans are on Medicaid or CHIP. There's another 20 million on the exchanges. There are a lot of people that will come to help us. So write this down, 1-800-HHS-TIPS. 1-800-HHS-TIPS. We have a URL, obviously, if you go to our website as well. And I'll leave you with one last thought. In addition to the massive fraud, especially from foreign entities trying to invade America using their financial tools and criminal mindsets, we also have 25% of all of our money being spent, probably subject to abuse. And that's not fraud. This is abuse and waste. Money not being used wisely. We just launched a new model called WISER with the Centers for Medicare and Medicaid Innovation under Abe Sutton that is looking at ways for us to identify inappropriate use of services that are wasteful and should not be offered to the American people because they could hurt them, and they're certainly not providing value for these wonderful Americans whose health is being taken advantage of to generate higher savings, higher revenue, rather, for providers. We're not going to tolerate it anymore. We're going to use data analytics, real-time monitoring, and unhesitating, unwavering pursuit of the law to make sure this happens. I want to thank my colleagues on the stage and their agencies for all the wonderful work you have done. God bless you.
Good morning. Hello, my name is Christopher Delzato, and I'm the Acting Deputy Assistant Director for the FBI's Criminal Investigative Division that handles healthcare fraud. I want to echo what our speakers have said already and thank everybody who made this takedown possible. Healthcare fraud is not a victimless crime. Every dollar stolen through deceitful billing or unnecessary procedures is a dollar taken away from patients who truly need care and taxpayers who fund these critical programs. Schemes like those we're announcing today drive medical costs up, strain federal health care budgets, and ultimately impact every American who relies on Medicare, Medicaid, and other public and private insurance programs. It's also not just about financial losses. It's about patients being exposed to unnecessary procedures, false diagnoses, and delayed care. That kind of exploitation isn't just unethical, it's dangerous and has no place in our healthcare system. We can't tackle healthcare fraud of this scale alone. It requires a united response. That's why strong partnerships are at the heart of what we do. This initiative is part of a strategic and coordinated effort with the Department of Justice's Healthcare Fraud Unit of the Criminal Division's Fraud Section, Health and Human Services, Office of Inspector General, Drug Enforcement Administration, and other federal and state agency partners. From investigators on the ground to analysts tracking intel, forensic accountants tracing financial trails, and prosecutors building cases that will hold up in court, every agency involved plays a critical role. By leveraging these critical partnerships, it allows all of us to share intelligence in real time and connect the dots across multiple jurisdictions, not only in the United States, but around the globe. This initiative brought together expertise from FBI headquarters and 28 field offices across the country working side by side to identify the scope of the fraud and coordinate arrests. From fraudulent billing, COVID relief abuse, and money laundering to prescription drug diversion, these criminal networks are engaged in complex schemes that operate on a global scale, undermining our healthcare systems and fueling broader transnational criminal activity. The investigations announced today speak volumes about our resolve to root out corruption in the healthcare system and hold accountable those who think they can defraud federal programs without being caught. I want to talk about the numbers for a minute because they're not just large, they're impactful. They reflect the scale of the fraud, the reach these criminal networks have, and the urgent need to protect our healthcare system. 324 defendants were charged criminally, including 96 licensed medical professionals, 25 of whom were doctors and charged for their alleged participation in various fraud schemes targeting government and private health insurance programs. Over $14 billion in alleged fraud was billed to Medicare, Medicaid, and private insurance programs. Unfortunately, those numbers represent Americans impacted in every state. Behind the numbers is a web of criminal activity that stretches far beyond our borders. The FBI's Operation Gold Rush resulted in the largest amount of loss charged in a healthcare fraud case brought by the Department of Justice. More than 20 members of a criminal organization based in Russia and elsewhere were charged for their roles in a $10 billion Medicare fraud and international money laundering conspiracy. The organization allegedly used a network of foreign straw owners, including individuals sent into the United States from abroad, who acting at the direction of others overseas, strategically bought dozens of medical supply companies that were enrolled in Medicare and located across the United States. After the organization gained control of the companies, it rapidly submitted billions of dollars in fraudulent healthcare claims that were never ordered by doctors, requested by patients, or provided to anyone. In doing so, the defendants are alleged to have exploited the identities of over 1 million Americans spanning all 50 states by using their confidential medical information to submit the fraudulent claims. This not only illustrates just how global these schemes have become, but how advanced and coordinated they are becoming. In Atlanta, 5 people, including 3 medical professionals, were charged with manipulating the price of skin grafts and forcing services on patients that were not medically necessary. In this case, Medicare was scammed out of $760 million. And in Phoenix, we opened an investigation after receiving a complaint about suspicious billing to Arizona Medicaid. It led us to a network of sober living homes that were supposed to be helping those struggling with drug and alcohol addiction, many of whom were Native Americans. Instead, this was a massive fraud scheme that billed for services that were never actually provided. The sober living home facilities owned by ProMD received more than $560 million for services that were not provided. Those are just some of the investigations that were part of this initiative. As these threats grow more complex and transnational, the FBI and our law enforcement partners must continue to evolve, stay ahead of the curve, and meet the challenges with equal force.
Version of controlled substances, seeking the revocation of pharmacies, medical practitioners, and distributors. In other cases, DEA helped investigate providers who stole opioids intended for their own patients, diverted fentanyl from hospitals, and exploited vulnerable individuals seeking treatment. And we didn't stop there. In the last 6 months, DEA has charged 93 administrative cases seeking the revocation of pharmacies, medical practitioners, and distributors' authority to handle and/or prescribe controlled substances. This sends a clear message. If you use your license to harm the public, you will lose it. This takedown also shows how closely drug trafficking and healthcare fraud are intertwined. Whether it's criminal enterprises billing for medically unnecessary opioids or laundering the proceeds from sham clinics and pill mills, DEA is targeting the financial, pharmaceutical, and criminal infrastructure behind the epidemic. As we move
After
forward,
the successful
DEA
testing
will
of the
continue to
Dreadnought
collaborate
Gundam
across
and the
government
ways
agencies.
freedom could and
Together,
would
we
a
are
lot of
building a
versatility.
smarter,
Other than a
data-driven
nice variety of
enforcement
weapons, it
model,
allowed the Justice to go
harnessing
into
the
high
power
mode
of artificial
by flipping it
intelligence
up.
and
This
forensic
granted the
analytics
Justice
to
incredible
stay ahead
to
of
rather than
criminal
carry out
actors.
his mission. Taking out
To
the
those who
high-speed
think
NASCAR
they
itself
can
didn't
hide
last
behind
long.
white coats or
This
offshore
would
bank
later on be
accounts,
rectified with
think
Meteor
again.
Unit those of the Jinn
DEA
shuttles
remains
and
relentless in our
shortly
pursuit of
after
those who
being
poison our
completed.
communities and exploit our healthcare system, all to line their own pockets with profit from others' pain. I, too, want to take a moment to recognize the remarkable work, commitment to healthcare and safety, and dedication of our DEA investigators and all our partners across the nation. Today's takedown is a milestone, but it's not the end. It's the foundation of what comes next. Thank you.
You mentioned in your remarks that this involved more than 1 million stolen identities. Any idea of how those identities were stolen, what breach they were part of?
Can't identify the specific breach they're part of, but they are on the dark web, among other places. They're internet-based identities that are put up for sale. And frankly, what would happen in some of these cases is individuals who were not even seeing a particular doctor for any sort of specific care often got a medical device at their home and reported that. And so their device may have been somewhere on the internet, either from one breach or multiple different breaches, and these are collected by the organizations who then would send devices to individuals who never requested them.
Can I offer this? This is a very important point for the American public to hear. They knock on doors, and they'll tell you that they've got something for free, and then they get your number, and they're off to the races. So this is why folks should guard their numbers, especially their Medicare number, very carefully.
Question for Dr. Oz, actually. When you talk to anti-fraud experts in the private sector, they say that one of the reasons these transnational groups are targeting government programs to such a massive degree is because it's been relatively easy for them to do that using the stolen identities that you mentioned, because government agencies don't use the same kind of technology that Citibank does, and Amazon does, and Walmart does. It sounded like from what you were saying earlier, you're working to change that. You mentioned AI. Can you talk a little more about that?
The WISER model, which is a CMMI model, much of the innovation in Centers for Medicare and Medicaid Services comes specifically from the statutorily created entity of Centers for Medicare and Medicaid Innovation, as the name would state. Have already launched a model. It is designed to use artificial intelligence and other more cutting-edge tools to address the fraud that exists in healthcare. And I have just 2 points on this I think are worth remembering. The reason that AI works so well in the financial systems is because bank managers aren't fraudsters usually, so they're not very good at fraud, whereas fraudsters are really good at fraud. So you're asking people who don't study fraud, like in CMS, for example, Amy Brandt does not spend her whole life thinking how to defraud people. So she doesn't think the way a criminal mind might work. So we actually benefit tremendously, has been the case in banking and other transactional businesses, if we can bring these newer technologies to bear. The other reality of healthcare is that we don't really penalize people for doing bad things. When they steal money, and they steal the health of Americans when they steal your money, because they're taking away resources that are vitally needed to take care of vulnerable Americans, is that we don't really penalize people for doing bad things. When they steal money, and they steal the health of Americans when they steal your money, because they're taking away, we actually benefit tremendously, has been the case in banking and other transactional businesses, if we can bring these newer technologies to bear. The other reality of healthcare is that we don't really penalize people for doing bad things. When they steal money, and they steal the health of Americans when they steal your money, because they're taking away resources that are vitally needed to take care of vulnerable Americans. When they do that, I think, not just criminal, but morally reprehensible activity, it's often a slap on the wrist. And that's an area where I think we should get more serious. Many of these fraudsters were able to get away literally outside the country, but even the ones we catch sometimes have remarkably impactful opportunities to escape real justice, and we have to change that as well. We also have to be serious. We've got to send a message. That's what today's press conference is about, and I'd love if you could echo that. We are taking this crisis to a whole different level. This is not going to be the same approach to healthcare fraud detection as has been evident certainly for the last few years.
You mentioned that the intended loss was north of $14 billion. Can you say what the actual loss was?
$2.9 billion.
I wanted to follow up about the rise in these foreign actors that you're seeing participate in these schemes. How can you address a little bit more about how the U.S. can combat that when so many of these criminals are beyond the reach of U.S. law enforcement?
Yeah, it's a great question. Look, the first thing we need to do is prevent more of the money from going out in the first place. Frankly, $2.9 billion actual loss on $14.6 billion intended loss is pretty good. It's less than a sixth, and we were able to prevent that by getting ahead of schemes early. So the best thing, the best antidote here is prevention rather than enforcement. Second, we're able to people who were coming into the United States on temporary bases, some of these straw owners and people who own these companies. Then we need to get serious sentences on these individuals to send that deterrent message. And the third thing we need to do, and which we are doing, is we're fighting for the extradition of many of these individuals. We hope to see them face justice in an American courtroom. So what we need to do, and the goal of all these taken together, is to make sure that people don't view this as some sort of calculated risk. It won't pay off, essentially, if we prevent, if we enforce, and if we get significant sentences.
On the transnational element to this, are these people that are just mostly looking to make as much money as they can, or is there a national security risk too to having people from these transnational groups involved in this fraud?
Yeah, we see, so astute question. So basically in some instances we see it's just sheer fraud scheme for money and related purposes, particularly at the lower levels of the pyramids, but we do have individuals who we have concerns about other activity they're connected to.
Can you say anything more about that?
No.
One of these cases involved defense overseas using artificial
for money and related purposes, particularly at the lower levels of the pyramids, but we do have individuals who we have concerns about other activity they're connected to.
Can you say anything more about that?
No.
One of these cases involved defense overseas using artificial intelligence to basically create recordings of Medicare beneficiaries. Can you talk about how this AI explosion and the kind of confluence of fraud and how you're kind of marshaling resources to attack that? And separately, Dr. Oz, you mentioned that this is largely about messaging and making clear that this kind of fraud is unacceptable. I wonder, does it undermine that message when President Trump recently pardoned Lawrence Duran, who was convicted in what was at the time the largest Medicare fraud scam in history?
Awaken to a world of wonder in Final Fantasy XIV Online.
Yes, we are concerned about
Take it easy and play your way.
Here, obviously, and it's something that contributed to some of the schemes we saw here. So, yes, we are concerned.
Does it undermine that message when President Trump recently pardoned Lawrence Duran, who was convicted in what was at the time the largest Medicare fraud scam in history? Does it undermine that at all?
I'll start with your first question. So, yes, we are concerned about the criminals' advancements in technology here, obviously, and it's something that contributed to some of the schemes we saw here. So let me say a little bit more about a word that we're doing on the Data Fusion Center that I think is significant. Basically, a lot of the information that is relevant to stopping these schemes is stored across different government agencies. And what the Data Fusion Center intends to do is put it all in one place so that we can recognize these patterns earlier on. So if you're looking at a graph for some particular kind of back brace, for example, and you see a hockey stick spike in the sales of these in some particular location in Miami, say, that's a very powerful lead for us to go after and to try to root out the problem before it grows. So yes, the criminal schemes are getting more complex, and that's why we need to advance with it. And the Data Fusion Center is a big part of that, and breaking down information silos across agencies.
Whether it's fishing, crafting, or taking on quests.
The president's been very clear that he wants this fraud, waste, and abuse crushed.
Play solo, or team up with your friends. Final Fantasy XIV Online. Play free today.
하나 더 찍었다. 아씨 진짜. 자, 그다음에 오른쪽도 하나, 둘, 세 개. 아, 여기도 네. 여기도 일단 여기 먼저 찍을게요. 오른쪽 하나, 둘, 셋 맞죠? 하나, 둘, 셋.
우리의 멘탈은 과연 튼튼한지
그리고 비서관 인선이 지금 계속 되고 있는 것 같은데 이게 따로 언론에 공개되거나 발표되거나 이러진 않고 있는 것 같은데 추후에라도 나중에 모아가지고 혹시 공개하거나 이러실 계획은 없는지 궁금합니다.
네. 첫 번째는 그 이종차 회장이 이렇게 서서 이렇게 모두 발언처럼 한마디씩 돌아가는 덕담을 할 때 이제 비서관실이 생겼으면 좋겠다라고 발언을 하신 상태라서요. 거기에 대해서 구체적인 어떤 대답이라던가 이렇게 있기에는 물리적으로 좀 시간이 부족하기도 하고 아마 말이 나온 이상 한번 살펴는 보지 않을까 싶습니다. 대통령실에서도. 근데 오늘 바로 이제 한 1시 정도에 제안을 하고 한번 이렇게 건의한 사항이다. 그러니까 바로 답을 드리긴 어려운 상태다라고 말씀을 드리겠고요. 비서관은 아직도 채 다 진용이 갖춰지지 않은 상태입니다. 그래서 인사검증을 거치고 나서 그 검토 중이신 분들도 뭐 내정과 그리고 임용 단계까지 좀 시간이 걸리는 상황이라서 지금으로는 확인하기 어려운 게 더 많고요. 그러므로 인해서 나중에 이제 비서관 진용이 다 갖춰지고 난 이후에 어떻게 할지는 좀 논의해 봐야 되지만 지금은 아직 다 갖춰지지 않은 상태라고 대답드리겠습니다. 네, 죄송한데 여기 좀만 더 하고 가겠습니다. 여기 뒤에, 여기 앞에 먼저 할게요. 네.
네, 채널A 홍지은입니다. 그 김용태 그 국민의힘 비대위원장이
네.
그 지난 대통령 그 오찬 때 그 김민석 국무총리 후보자 그 문제 제기를 하니까 이제 뭐 대통령께서 뭐 젊은 비대위원장은 파면 안 나올 것 같냐 이렇게 말했다고 이제 김 위원장은 주장을 하고 있는데 이게 아무래도 한쪽 주장이다 보니까 좀 사실관계 확인 좀 부탁드립니다.
네, 확인해 보겠습니다. 그건 저도 들은 바 없는 내용이라서요. 네.
네, 안녕하세요. SBS 비주 우영준 기자입니다. 오늘 금융위에서 부동산 대출 규제 발표를 했고 공급 대책 관련해서 여쭤보려고 하는데요. 그 지난 25일 국정기획위원회에서는 신도시 카드 고려 안 한다라고 하셨고 어제는 진성준 민주당 정책위 의장이 신도시 카드 고려해야 한다 이렇게 말씀을 하셨는데 이와 관련한 대통령실 입장 여쭙습니다.
네, 제가 알기로는 기재부에서 나온 대책으로 알고 있는데 대통령실 대책이 아닙니다. 일단 부동산 대책에 대해서 지금 저희는 아무런 입장이나 혹은 그 정책을 내놓은 바 없다라고 말씀드리고 혹시나 혼선을 빚을까봐 지금 다양한 그런 게 기재부 대책이라던가 의견들을 지켜보고 있는 상황입니다. 네. 네.
네, 저 TV조선 최민식입니다. 오늘 대통령께서 오찬 자리에 서해 참전 용사들을 많이 부르셨고 또 최원일 함장도 부르셨는데요. 과거에 살짝 불편했던 기류가 있었는데 이번 오찬을 계기로 좀 해묵었던 오해나 감정들은 좀 다 해소가 된 건지 이런 부분 궁금합니다.
네, 대통령실을 비롯한 행사에서 가장 중요한 점은 사회에 어떤 신호와 방향성을 주느냐가 아닐까 싶습니다. 그런데 통합이라는 것 그리고 과거의 문제는 과거의 문제고 앞으로 우리가 살아가는 데 있어서 더 다름은 아주 사소하고 같은 방향을 보자는 게 이재명 정부의 큰 방향성이라고 말할 수 있겠고요. 보훈 행사 역시 그 약간의 다름으로 인해서 나눠주기에 어려운 대상이 바로 보훈이라는 게 이재명 대통령과 이재명 정부의 생각입니다. 국가를 위해서 어떤 식으로든 희생이 있고 그리고 한편으로 그로 인해서 안타까운 목숨의 희생이 있었다면 충분한 보답과 사회적 예우가 있어야 한다라는 게 이재명 정부의 계속된 철학이라고 말씀을 드리고 네, 그게 굳이 뭐 통합의 어떤 행보 그리고 지금 내정된 보훈부 장관 역시도 권오을 장관입니다. 내정자 역시 그 역시도 하나의 신호이자 철학의 반영이라고 보시면 될 듯합니다. 또 있을까요? 저기 제일 뒤에 네.
네, CBS 허지원입니다.
네.
그 오늘 같이 국가유공자들 초청하는 행사 같은 경우에는 좀 대통령실에서는 경청 통합수석실 담당처럼 생각이 되는데 이 부분이 아직 다 공석이어서 업무가 어떻게 좀 처리가 되는지랑 지금 그런 비서관들은 사실 내정이 돼 있어서 이 일이 진행되고 있는지 뭐 발표는 언제 나는지 설명 부탁드립니다.
네. 그